past few years, the Veterans Administration has increased the use of acupuncture medicine and related modalities. As the demand for these services increases, many Veteran Administration medical centers have expanded the availability of acupuncture. The purpose of this video is to provide a sample of acupuncture approaches and share the impact it has had on some within this population. My name is Jennifer Williams. I am a veteran and the spouse of a veteran who proudly served 28 years. I am also a doctor of acupuncture and Chinese medicine and have a PhD in counseling research. While serving at an Army medical facility on Fort Bragg, North Carolina, as a licensed acupuncturist for active duty soldiers and veterans for 2 years, and 1 year at a local VA providing acupuncture to veterans, I was able to identify misconceptions about acupuncture and the basis for some of the confusion. At a few VA medical centers, there are contracted and Federal Service licensed acupuncturists that address a variety of presentations and offer many forms of acupuncture approaches. There are also other provider types that offer forms of acupuncture for veterans within some VA medical centers. Outside most VA medical centers, there are licensed acupuncturists who provide fee-basis acupuncture in the community when the demand for acupuncture services exceeds the 30-day wait, or if a veteran requires acupuncture approaches that are not feasible within a given VA medical center. Daniel is a veteran who suffered a stroke about 11 years ago. About 5 months ago, his VA medical center sent him to a licensed acupuncturist in the community who specializes in post-stroke, brain injury, and neurological acupuncture. There are types of acupuncture approaches that provide sustained relief from chronic pain while significantly improving function, balance, voice, and gait. When Daniel started acupuncture, his primary complaint was frozen shoulder with 10 out of 10 level pain, excruciating, and unrelenting. So what do you see that's changed, Liz?
I see balance improvement. That was the first thing I saw in improvement. The second thing was the pain has reduced quite significantly. He had severe pain 24/7. I see when he steps now, his gait is much more level. He's much more balanced. He doesn't wobble like he used to. He used to walk and he used to wobble. His arm is now doesn't look as atrophied as it used to, okay? The arm used to look very atrophied and now it's getting tone, it's getting muscle back. It's starting to look very much like his other arm. He is working that out as well. The swelling in his left leg and calf has been reduced. His leg used to be, I'm going to say, almost twice as large, his calf, as his right leg. I see when he walks on the stairs now that he can bend his knee. He doesn't swing as much, but when he's walking down the steps, I see more movement there as well, improvement in the joint of the knee there.
He should now work with the VA physical therapy team to further improve his balance, muscle tone, and confidence. Licensed acupuncturist working with licensed physical therapist is one of many cooperative approaches in the VA Whole Health Initiative.
I have to say that it works really well. I do not hurt nearly as much as I used to. I used to have to live on 800 milligram Motrin. I mean, I would take them 2 to 3 times a day, and now I take them once, maybe twice a week, and I'm extremely happy with that. It's helping my liver, and I really need help with that. I had surgery on my knee and my hand since seeing them, beginning to see her, and she has exponentially increased my recovery on both of them by getting rid of excess fluids, the swelling, and helping everything mend.
My name's Albert John Ellis Jr. I'm a patient at the Mountain Home VA, being taken care of for blood clots initially in my lower legs and abdomen, and at the time of the last blood clots, I was swollen from my hips all the way to my ankles with no circulation of blood or very poor circulation of the blood. The acupuncture seems to be working, whereas some of the people at the VA told me that I wouldn't have a chance of ever getting any feeling or balance back in my feet or coloration. No, that one was in
I can see it.
the
Second,
my longest.
the second big toe, yeah, I saw it.
Bloodletting is an ancient Chinese method that can be applied modernly to several different situations. It's especially effective for helping to invigorate blood and qi. In a scenario like this would be to help improve circulation. It's also good for dispersing qi and blood stagnation where there might be areas of pain or discomfort. It's also really great for draining heat and fire, such as bleeding the thumb for a sore throat. And we can also use it very effectively for bringing down high blood pressure if we bleed the ear apex.
As Dr. Engelbrecht explained, bleeding the apex of the ear can reduce high blood pressure. Ear acupuncture is a microsystem that can affect descending pain pathways of the central nervous system and neuromodulate activity in the brain. Stimulation of specific points on the external ear result in neural responses in the brain. Neuromodulation from ear acupuncture can increase or decrease activity in the brain. Decreasing activity can sometimes increase pain, particularly in those with pain dysregulation often seen in veterans with PTSD and chronic pain. Although ear acupuncture may not meet the standard of sustained pain reduction or functional improvement established by the Veterans Administration, it can provide temporary relief for someone immobile or when there's only a moment to treat. Most ear acupuncture protocols consist of 3 to 5 specific locations in the ear. The National Acupuncture Detoxification Association, NADA, protocol was designed in 1971 for addiction and comorbidities. The Battlefield Acupuncture, BFA, protocol was designed in 2008 for active duty military acute pain. The Heal, Relax, Open, HERO, protocol was designed in 2018 for veterans with chronic pain and comorbidities who are transitioning to self-care. Many providers at the VA can perform ear acupuncture, which can be helpful in a pinch for those operating or functioning at a high level or at a low level when immobile. Another acupuncture approach is dry needling, a term coined by physicians Travell and Simon, who determined that a muscle trigger point or hyper-irritated band released without an injectable substance in the hypodermic needle. While acupuncture needles are dry, the term dry needling is now used to distinguish the insertion of a solid needle for the purpose of releasing a trigger point, hyper-irritated band, or knot in a muscle for the purpose of enhancing a physical therapy session. Physical therapists are required to take 30 to 50 hour class to perform dry needling. Until recently, research on acupuncture has been confined to a framework used to evaluate the efficiency of pain medication. Thus, a common misconception is that acupuncture is for temporary pain relief. Acupuncture is not a drug, but even fundamental acupuncture approaches can result in pain relief and be helpful for those operating or functioning at 80% or higher level. Now there is research demonstrating the efficacy of acupuncture outside pain. The evidence is significant for veterans operating or functioning under 70%. Techniques used by licensed acupuncturists can either reduce or build. For example, using manual or electric stimulation approaches in a muscle motor point can reduce pathogenic fluid such as inflammation. Using a different technique in a muscle motor point can activate the function in another part of the muscle. These techniques can often release a nerve, improve conductivity of a nerve, or facilitate repair of a damaged myelin sheath.
I started having a lower back pain, numbness down my right leg, and a burning sensation. Felt like someone poured hot grease on my leg. After about 4 years of going to the VA, and they sent me to a chiropractor outside, and that didn't help. And so I heard about acupuncture, and I thought, well, hey, give it a shot. And I can't believe what it's done for me. I thought I was just going to have to put up with the numbness and burning sensation for the rest of my life, but I noticed a difference from the first visit. It was, much better. And now that it's been coming for a while, it's, you know, it's probably 80% gone. It's really helped me, and I'm able to sleep a lot better at night, not having as much pain. And before, when we first started, maybe after a day or so, I'd start feeling a little bit of discomfort again. But now it seems to be almost gone. You know, so say like an 8 or 9 in pain, I'm now 3 or 4 most of the time at the most. So it's just really beneficiary. I can't believe how well it helps.
This summer has been the best summer that she's had. Heat typically bothers her and causes her to not be able to walk. A lot of problems with stuttering. None of that has happened this summer. We've actually been out doing more because of her feeling so much better. We've been kayaking for the first time in 3 years. We've been out on the lake on a jet ski. We've been to the beach on vacation.
Been hiking, fishing.
And none of her symptoms have came back this year.
Yeah, my joints haven't swollen. So that's the first time in 3 years that I haven't felt like garbage because of the heat.
Well, my neck was, when I first come, I couldn't even move it, and now pain is just about gone. It still hurts some, but not like it did. It's made my neck feel a whole lot better. I can turn it better now.
Okay.
And it's not near as painful as it was. My balance is better than it was.
And how long does the relief last for you after your treatments?
Usually 3, 4, 5 days. I've took pain pills, but they don't help.
Okay. And have you had any side effects with those pain pills in the past?
Oh yeah.
Okay. What kind of side effects were you experiencing?
Sick at my stomach,
Okay.
diarrhea.
Thank you very much.
Okay, thank you.
Thank you for watching our video, and a big thanks to NCCOAM and ASA for all that you do, and thank you to the acupuncturists who take care of our veterans.